Welcome to our channel. Today, we're diving into a crucial topic, 7 signs your health needs immediate attention. You know, as a doctor, I always tell my patients that our bodies are incredibly intuitive. They give us signals when something isn't quite right. The problem is we don't always know how to interpret those signals. That's why I'm here to break down these 7 red flags that should never be ignored. We're going to talk about what these symptoms could mean and why it's so important to seek medical help right away. Remember, early detection is key when it comes to your health. Stay tuned to learn how to recognize these important signals and take charge of your well-being. Let's get started. Okay, first up is sudden weight loss. This can be a startling experience for anyone. Imagine stepping on the scale and seeing a number that's significantly lower than what you're used to, without having made any conscious effort to lose weight. It can be both confusing and concerning. Now, we're not talking about shedding a few pounds after a holiday feast. It's normal to see some fluctuation in your weight after indulging in festive meals or during special occasions. Those few extra pounds usually come off once you return to your regular eating habits. I'm talking about an unexpected, significant drop in your weight without any major changes in your diet or exercise routine. This kind of weight loss can be quite alarming because it often happens without any clear reason. You might notice your clothes fitting more loosely, or find yourself needing to tighten your belt more than usual. If you find yourself going down a pant size or two without even trying, it's time to pay attention. This isn't just about aesthetics, it's about your health. Unexplained weight loss can be a red flag that something is going on inside your body that needs to be addressed. Sudden weight loss can be a sign of a variety of underlying conditions, some of which can be serious. It's not something to ignore or brush off. Your body is trying to tell you something, and it's important to listen. We're talking about things like thyroid issues, where your metabolism goes into overdrive. Hyperthyroidism, for example, can cause your body to burn calories much faster than normal, leading to unexpected weight loss. Other symptoms might include increased heart rate, anxiety and difficulty sleeping, or even certain types of cancer that can sap your energy and appetite. Cancers of the digestive system, for instance, can interfere with your body's ability to absorb nutrients, leading to weight loss. Additionally, the body's increased energy demands to fight the disease can also contribute to this issue. Now, I don't want to alarm you, but it's crucial to get checked out by a doctor to rule out any serious causes. Early detection and diagnosis can make a significant difference in treatment outcomes. Your doctor can run tests to determine the cause of your weight loss and recommend appropriate treatment. Remember, early detection is key. The sooner you identify the cause, the sooner you can take steps to address it. Whether it's a thyroid issue, cancer, or another condition, catching it early can improve your chances of successful treatment and recovery. So, if you notice unexplained weight loss, don't brush it off. It's easy to dismiss it as a fluke or think it might be a temporary change, but it's better to be safe than sorry. Pay attention to your body and take any significant changes seriously. Make an appointment with your doctor and get to the bottom of it. Your health is worth the effort, and addressing any potential issues early can make all the difference. Don't wait, take action and ensure you're on the path to good health. Let's talk about another sign your body might be trying to tell you something's up. Persistent fatigue. This isn't just your average tiredness that comes and goes with a busy week or a late night out. Persistent fatigue is a constant, overwhelming sense of exhaustion that doesn't seem to improve, no matter how much rest you get. We all feel tired from time to time, right? It's normal to have days where you just don't feel like you have the energy to do much. Maybe you stayed up too late binge-watching your favorite show, or perhaps you had a particularly stressful day at work. But what if this tiredness never seems to go away? But this is different. I'm talking about that bone-deep exhaustion that just doesn't seem to go away, no matter how much sleep you get. It's the kind of fatigue that makes even the simplest tasks feel like monumental efforts. You might find it hard to concentrate, feel irritable, or even struggle to stay awake during the day. You wake up feeling like you've run a marathon, even though you just rolled out of bed. Your body feels heavy, your mind foggy, and no amount of coffee seems to help. This isn't just about feeling sleepy. It's about a profound lack of energy that affects your entire day. This type of fatigue can be a sign of a whole range of things, from nutritional deficiencies like low iron levels to hormonal imbalances or even mental health conditions like depression. It could also be related to chronic illnesses such as fibromyalgia or chronic fatigue syndrome. Sometimes it's your body's way of signaling that something deeper is going on. Now, I know it can be easy to brush off fatigue as just being stressed or busy, but trust me, if you're feeling drained day after day, it's worth getting checked out. Persistent fatigue isn't something to ignore. It can significantly impact your quality of life, making it hard to enjoy activities you once loved or even perform daily tasks. Your body is trying to tell you something, so listen up. Pay attention to these signals and take action. Whether it's adjusting your diet, seeking medical advice, or making lifestyle changes, addressing persistent fatigue can lead to a healthier, more energetic you. Don't wait until it gets worse. Take steps to understand and alleviate your fatigue today. Alright, let's talk about headaches, specifically severe headaches that seem different from your usual tension headaches. We've all had headaches, but when the pain is intense, throbbing, or comes on suddenly, it's a whole different ballgame. This is especially true if the headache is accompanied by other symptoms like fever, stiff neck, confusion, or vision changes. These could be signs of something more serious like meningitis, a brain aneurysm, or even a stroke. Now, I know it can be scary to think about these possibilities, but that's exactly why it's so important to seek immediate medical attention if you experience a sudden, severe headache, especially if it's unlike anything you've felt before. Don't wait to see if it goes away on its own. Get to the ER or call emergency services right away. Chapter 4. Red Flag. Number 4. Chest pain. Chest pain. This one's a no-brainer, guys. Chest pain is never something to ignore, ever. It's your body's way of screaming at you that something is wrong, and you need to listen. Now, chest pain can feel different for everyone. Some people describe it as a crushing pressure, while others feel a sharp, stabbing pain. It can radiate to your arms, jaw, back, or even your stomach. But no matter what it feels like, any type of chest pain, especially if it's accompanied by shortness of breath, sweating, nausea, or dizziness, warrants immediate medical attention. We're talking about potentially life-threatening conditions like a heart attack or a pulmonary embolism, and every second counts, so call 911 or get to the nearest emergency room as quickly as possible. Let's talk about shortness of breath. Feeling like you can't catch your breath, especially if it comes on suddenly or is severe, is another major red flag that should never be ignored. This could indicate a problem with your lungs, heart, or even your blood circulation. We're talking about conditions like asthma, pneumonia, a blood clot in the lungs, or even heart failure. Now, I know it can be scary to experience shortness of breath, but try to stay calm. Sit down, loosen any tight clothing, and try to slow down your breathing. If you have a rescue inhaler for asthma, use it as directed. But most importantly, call 911 or have someone drive you to the emergency room immediately. Don't wait to see if it gets better on its own. Okay, this next one might feel a little awkward to talk about, but trust me, it's important. Changes in your bowel or bladder habits, especially if they persist, can be a sign of something more serious going on. We're talking about things like blood in your stool, persistent diarrhea or constipation, needing to urinate more frequently, pain or burning during urination, or even incontinence. These changes could indicate a range of issues, from infections to inflammatory bowel disease, irritable bowel syndrome, or even certain types of cancer. Now, I know it's not the most glamorous topic, but your digestive and urinary systems are crucial for your overall health. So don't be shy about talking to your doctor if you notice any persistent changes in these areas. Last but not least, let's talk about unexplained pain. This type of pain can be particularly frustrating and worrisome because it often comes out of nowhere and doesn't have an obvious cause. It can strike at any time and affect any part of the body, making it difficult to carry on with daily activities. Our bodies are pretty good at telling us when something's wrong, and pain is one of the most obvious ways they do that. Pain is a signal from our nervous system that something might be amiss. It can be sharp or dull, constant or intermittent, and can range from mildly annoying to completely debilitating. If you experience any new, persistent, or severe pain that you can't explain, it's crucial to get it checked out by a doctor. This is because unexplained pain can sometimes be a symptom of a more serious underlying condition that needs medical attention. Early diagnosis and treatment can make a significant difference in outcomes. This is especially true if the pain is accompanied by other symptoms like fever, swelling, redness, or difficulty moving the affected area. These additional symptoms can provide important clues about what might be causing the pain and help your doctor make a more accurate diagnosis. Now I know it can be easy to dismiss pain, thinking it's no big deal or it'll go away on its own. Many of us are guilty of pushing through the pain, hoping it will resolve itself. However, this approach can sometimes do more harm than good. But ignoring persistent pain can sometimes allow underlying conditions to worsen. Chronic pain can lead to a decrease in your quality of life, affecting your ability to work, exercise, and even enjoy time with family and friends. It can also lead to other health issues, such as depression and anxiety. So if you're experiencing unexplained pain, don't hesitate to reach out to your doctor. It's always better to be safe than sorry. Your doctor can perform tests and evaluations to determine the cause of your pain and recommend appropriate treatments. They can help you figure out what's going on and get you the treatment you need. Remember, your health is important, and addressing pain early can prevent more serious issues down the line. Don't ignore what your body is trying to tell you. Thanks for watching. I hope this video has empowered you to be more aware of your body and the signals it might be sending you. Remember, your health is your most valuable asset, and it's always better to err on the side of caution. If you're experiencing any of these 7 signs, don't hesitate to reach out to your doctor or seek immediate medical attention if necessary. Early detection and treatment can make a world of difference. If you found this video helpful, don't forget to like, share, and subscribe for more health tips. Stay healthy and take care.